Thank you all for joining us here this afternoon. I'm grateful to have with me today Health Services Director Dr. Cara Christ, Wendy Smith-Reeve, our Director of Emergency Management, Dana Kennedy of the AARP, and Dave Voipel of the Arizona Healthcare Association. As I stated earlier this week, protecting public health is our top priority. When it comes to COVID-19, we've followed the facts and we've followed the advice of our top health professionals, the Department of Health and Human Services, the Centers for Disease Control and Prevention, and the World Health Organization. This morning, the Department of Health Services announced 3 additional presumptive positive cases of COVID-19, bringing Arizona's total to 9. And the World Health Organization declared COVID-19 a global pandemic. Our approach has been to be calm, steady, and transparent, and to act with urgency to protect public health. This approach allowed Arizona to become one of the first states in the nation to be certified by the CDC to test for COVID-19. We've been conducting regular briefings, webinars, and providing guidance to community stakeholders, including school administrators, healthcare providers, government officials, and business leaders. We've also coordinated closely with experts on the ground, including hospitals, nursing home facilities, and local health officials. Their input has helped guide our actions, and we're grateful for their partnership. While Arizona is not currently facing the number of cases we've seen in some other states, we are anticipating additional positive cases, and we're not taking any chances. This is about public health and protecting lives, especially those of our elderly and most vulnerable. That's why today I'm taking additional actions. The first is a procedural step to remain ahead of the virus. I'm declaring a declaration of public health emergency. Here's what the declaration does. It allows the state to quickly tap into additional public health emergency resources when needed to combat the virus. It allows the state to waive licensing requirements to provide healthcare officials with assistance in delivering services during times of heightened demand. It provides hospital and healthcare facilities, such as nursing homes, the flexibility to implement enhanced safety protocols. And it gives health officials additional authorities to procure needed medical supplies. This is a proactive measure, and it ensures that Dr. Christ and her team will have all the tools and resources that they need to protect Arizonans. The second action comes from discussions with our healthcare professionals and healthcare providers. It's an executive order aimed to protect those most at risk for COVID-19, our elderly citizens and those with underlying health conditions. Here's what my executive order does. It requires nursing homes and assisted living facilities to implement visitor policies, including enhanced symptom checks for all healthcare workers and visitors. This will allow Arizonans to continue to visit their loved ones while protecting those most at risk. It requires insurance companies and health plans to cover out-of-network providers, including laboratories and telemedicine for COVID-19 testing. It protects consumers by prohibiting price gouging of testing for COVID-19. And it requires insurance companies to cover 100% of the cost of testing. Some may ask, why now? Why today? Here's why. This is an important proactive action. To date, we have not had community spread at a nursing home or elder care facility, but we could. And if that happens, we want DHS to be equipped to act immediately and with urgency. At the same time, we know there's more that can be done right now to protect vulnerable populations and that's what this executive order does. These are our latest steps, and they will not be our last steps. This will continue to be my top priority 24/7. But nothing here today should be misinterpreted. These are proactive measures to limit community spread. To our citizens, continue to follow the Department of Health Services guidelines on how to stay healthy at azhealth.gov. We will continue our approach of being calm and steady in our efforts to protect public health, and we'll continue to provide facts as we have them in a timely and transparent manner. And we need the help of community leaders, our partners, and the media to ensure all Arizonans understand the risks and the facts. Now I'm going to hand it over to Dr. Christ.
Thank you, Governor Ducey, for your leadership and making the health and safety of our communities the top priority of your administration. I'm grateful for the partnership we have in working with DEMA Deputy Director Wendy Smith-Reeve and community stakeholders, including Dana Kennedy with AARP and Dave Vopel of the Arizona Healthcare Association. My team has been working nonstop in response to COVID-19 to ensure we keep our communities and families safe. We are constantly monitoring local, national, and global activities so that we can make data-driven decisions that protect our communities while having as minimal of an impact on Arizonans' daily lives as possible. I want to thank Governor Ducey for taking swift action with the emergency declaration and executive order to provide health officials and administrators with tools and guidance necessary to combat the continued spread of COVID-19 and to reduce financial burdens on Arizonans by lowering the healthcare costs associated with this virus. Today, the Centers for Disease Control and Prevention announced that Arizona will receive $12.4 million to support the public health response to the COVID-19 outbreak. This is in addition to the $500,000 we have already received from CDC. So first, I want to provide the latest information about the spread of COVID-19 in Arizona. To date, we have had 9 cases in Arizona. 2 of those cases have been confirmed by the Centers for Disease Control and Prevention, and the other 7 are presumptive positive cases tested at the Arizona State Public Health Laboratory. These are tests that are pending confirmation from the CDC, but we do count them as cases in the state and take appropriate public health action based on the results. There are 3 cases in Maricopa County, 5 cases in Pinal County, and 1 case in Pima County. For specific information about those cases, I will direct you to our county public health departments who are conducting those case investigations. We now have community spread of COVID-19 in Arizona, and we are expecting more cases. Our goal is to mitigate the spread of the disease and lessen the impact on people at the highest risk for serious complications. While the risk of COVID-19 to the state is generally low, there is a heightened level of risk in areas where COVID-19 has been detected. People at highest risk for COVID-19 are older adults and people with serious medical conditions like heart disease, diabetes, or lung disease. People at high risk should be prepared if an outbreak happens in their community. We encourage them to have supplies on hand, such as extra prescription medications, over-the-counter medications, and supplies like tissues and other household items and groceries. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas in your house like doorknobs, light switches, toilets, faucets, and phones. And stay away from crowds if possible. Finally, have a plan if you get sick to call your healthcare provider and identify who else can care for you if your caregiver becomes ill. To stop the spread of COVID-19 and protect our most vulnerable community members, we ask everyone to routinely implement infection prevention measures. The best way to prevent the spread of respiratory viruses are to wash your hands with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick and cover your cough or sneeze with a tissue and immediately throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And if you need to see a healthcare provider, consider using telemedicine if this is an option. We urge everybody to find reputable sources for information about COVID-19. Your public health departments are great sources that will provide factual and up-to-date information. The CDC and ADHS both have information on their websites that you can find up-to-date and factual information. And the Poison and Drug Information Centers in Arizona are partnering with public health to offer a COVID-19 hotline for the public and medical providers. This hotline can now be contacted at 1-844-542-8201. Again, I want to assure everyone that the public health system in Arizona is prepared to respond to the spread of COVID-19 in Arizona, and we will continue to provide the public with the most up-to-date information and advice on how to keep your loved ones safe. Now, I'd like to introduce Dana Kennedy, the State Director of AARP. We know that people over 60 are at higher risk for serious complications of COVID-19. And throughout this response, AARP has been an incredible partner, and we are so lucky to have Dana leading these efforts to keep this community safe.
Thank you, Governor and Dr. Christ. And just for the record, I am not an expert in this area or this virus. I am an expert in aging and our long-term care system. And since reading about what happened in Washington, I have just been mortified as far as what happened and why it happened and what we could have done to prevent it. And I am so honored that our governor and Dr. Christ has been taking the lead and taking swift action to make sure that we do not have that type of situation happen here in Arizona. And I'm very proud that I had to clear my calendar on Monday, as well as today, to really give input and be a community partner to make sure what happened in Washington does not happen here in Arizona. So thank you for your leadership. AARP is proud to work with you, and we look forward to continuing to collaborate. I'd now like to turn it over to Dave.
On behalf of the Arizona Healthcare Association, I would like to thank Governor Ducey and Director Christ and the whole team at ADHS and Access for all of their hard work and collaboration. It's very unique to come into this type of situation and have the type of collaboration that is going on with the state of Arizona and long-term care providers. We represent skilled nursing facilities around the state, and we have two objectives. The first objective is to keep COVID out of the building, because as Dr. Chris said, that the senior population and in those buildings, that senior population averages in their low 80s, and they have acuity issues going on. So not only respiratory, but other types of issues. That's why they're in a skilled nursing facility in the first place. If COVID enters the building, you will see a much different rate of fatality than you would normally within a healthy population. So our first step, number one, keep COVID out. Our second step, if it does enter a building, then the second step is containment. And fortunately, we have the backing of DHS and the governor's office to limit visitations and to take the necessary steps now for infection and control. Those providers and those compassionate folks that are dealing with this on a day-to-day basis have been working on this for many weeks, and we couldn't do it without them. They are the frontline staff, and I truly appreciate what the governor and the director have done to help us put some teeth into visitation policies. So thank you.
Now we have time for a few questions from the media.
We'll start over here with Howie. Governor, let me ask you a question. You know, come up to the mic, we need you. You know, I've been covering the legislature for a while. The Republican-controlled legislature has repeatedly rejected any legislation that would allow for the Attorney General to enforce price gouging law. Under what authority do you think you can say we're going to prosecute people or keep people from price gouging? Because I know nothing in state law that allows that.
Under the authority of this emergency declaration, along with this executive order, we will enforce that there will be no price gouging.
But what I'm saying is there is no basis. I've looked at your emergency powers.
Thank you, Howie. We've consulted with attorneys. Okay, this is the executive order and the emergency declaration.
Yes, Governor and Doctor. Understand that one of the patients is a 90-year-old. Wanted to find out. You said that there will be proactive steps taken to protect these folks. What skilled nursing facility? What has been done on state level to find out how that person got the coronavirus and what's being done to ensure the safety of everybody that lives and works there?
So I can take that one. So Maricopa County is currently investigating to identify how that individual may have gotten exposed to COVID-19 and where that source may be. And then they will be working directly with that healthcare provider to ensure that there is appropriate cleaning put in place, that there is appropriate protocols, and that there is ongoing monitoring of additional contacts of that patient.
And two healthcare providers I've heard as well. This may have been from the now cases, from the Brazo Heart Hospital. What steps are done there for a vulnerable population that is obviously the patients in the heart? Can you enlighten me on any of that?
So that would be the same type of process. If anybody is in any type of facility that could expose others, we follow up with close contacts. We ensure that they have infection control protocols put in place, and we will provide technical assistance both from a licensing and a public health.
But is that anything different than now that the governor has declared this healthcare emergency? Does that give you more authority to ensure that that's going on?
Yes. So in the declaration and the executive orders, it gives us the authority to be able to work with licensing. We will be doing emergency rules to ensure that infection control procedures are put in place specifically to address this, as well as visitation policies.
We'll go to Stephanie and then Bob.
So we're in the media getting a lot of calls from angry Arizonans who say they want a coronavirus test and they cannot get one. What's the message from public health about that?
So we would encourage that if you do not have symptoms for COVID-19 right now, you do not need to be tested. For those that might have symptoms and feel that they are at risk for contracting COVID-19, we would recommend going to see your personal healthcare provider or urgent care. What we do have diagnostic laboratories that are coming online, and that poison control and information center line that I gave you will help private or personal providers triage to determine if that's a public health specimen or if that should go through the diagnostic laboratories. We'll be working with our healthcare providers so that they're aware of these options, and then providing them with technical assistance on how to collect the test, how to send it in, so that we can increase capacity.
Governor Ducey, Governor Inslee of Washington put a ban on large gatherings today of over 250 people. We have a lot of activities in Arizona during this time of year. It's our high season. Are you considering doing the same spring training games, other events? And if so, if you're not, why not?
I'm going to let Dr. Christ go first.
Sure. So at this time, we are not recommending of canceling mass gatherings in Arizona. So we are working right now with the CDC on brand new community mitigation guidance that they just put out. And we are not at a point where we would recommend those types of things, but we are constantly evaluating to see if those measures do take sense. But at this time, we are not there.
Well, if we have community spread and you want to stop it, isn't that a smart thing to do?
So there are various tools in the toolbox that we can use. Right now, we are not at widespread community transmission. That would be one of those triggers that could potentially have us using that tool.
Peter over here and then Brand.
Follow up on some of the stuff that's said already. What is cleaning the facility mean where this 90-year-old patient had coronavirus? And also, talk about, are there other groups doing testing right now outside of the Department of Health?
So yes, so a cleaning would be to disinfect and thoroughly clean the surfaces that that individual may have come into contact with, that room, and then ensuring that high frequency touched surfaces are disinfected and cleaned, and then continuing that on a routine basis.
So nothing special. It's just
The
the usual primary.
They have to have policies and procedures. Usually we refer to that in healthcare as like a terminal clean. It's more extensive than it would be if it was just like while the patient was in the room. And then for testing, we do have, so the Arizona State Lab is testing. LabCorp has been testing for the past couple of days. We understand that Quest just came online today. We're also working with TGen on surveillance testing, and we believe that Mayo is coming up with testing here shortly as well.
Just a couple things. To clarify that 90-year-old patient, is that an inpatient or an outpatient at the healthcare facility?
The patient is currently hospitalized and recovering from what I understand.
But when diagnosed, was that person an outpatient?
I would need to refer you to Maricopa County because I don't know that detail.
Regarding mass events, next week we have a huge mass event. Tens of thousands of students are returning to Arizona State University. Do you recommend that ASU think about suspending classes or suspend classes, and have you been in contact with anybody at ASU about what to do?
So we have been working with our university partners. We provided a webinar last week, invited all of our universities to provide technical assistance and guidance and make recommendations. At this time, we do not have a recommendation that ASU or U of A were to cancel in-person classes. We have heard that they are working on ensuring that their instructors have access to distance learning. But what we would encourage is if you are to take those normal precautions. So if you are sick, do not attend class. Make sure that you're washing your hands frequently, that you have access to either soap and water or alcohol-based hand sanitizer, and then making sure that they are staying up to date with their cleaning of their environment and having all of that available.
Interesting question if I can. This involves nursing facilities. Shouldn't every staffer, employee at a nursing facility be tested for the virus regularly?
So that's where it gets a little bit tricky. These tests we would not recommend routine testing unless somebody is symptomatic, and we would ask that they would stay away and see their healthcare provider. This is different than if there was just a one-time exposure, because you could get tested and then come into contact with someone who's sick and get immediately exposed. So it's a tough question. If we had an outbreak in a particular facility and we continued to have ongoing transmission, that may be a tool that we would utilize.
You may have people infected right now and you don't know it because they haven't been tested.
Right. And we expect that we do have members in the community that are positive.
I'm talking about healthcare facilities in particular.
Yes.
Nursing homes more directly.
Which is one of the reasons why we want to make sure that we're establishing these rules for infection control policies, as well as having the visitation, because we do know it's out there in the community. And as we identify more testing, we'll identify more cases.
We're going to come in front here in front of Mark.
Yeah, Dr. Chris, due to community spread, last conference you mentioned that it is recommended to avoid large crowds. Are you taking that back, talking about mass events?
No, what we are recommending is that if you are elderly or have a chronic underlying medical condition, you should avoid large crowds. You should take precautions to isolate yourself. If you are healthy, we are recommending that you continue to go to work. Just make sure you're taking those viral respiratory illness precautions.
Anybody a question just to the left here? Go ahead.
Governor Ducey, what do you say to employers? I know a lot of workers are concerned about missing on a paycheck because they might be in quarantine or feeling sick.
Well, I would again say, reiterate what Dr. Chris said about if someone is sick, has a temperature, they should not be going to work. We have seen employers updating their policies. Basically, as we were preparing for the press conference, I think McDonald's, Walmart, Darden restaurants as well. So people are addressing this situation. I think they see the risk in having employees that are sick at work in front of other employees and customers, and we encourage them to continue to do that.
And then Dr. Chris, today I was actually in a home with a couple who had dementia, and the healthcare worker said even if they get the coronavirus, she would still attend work and just wear a mask. What do you say to her? Is she doing the right thing?
We would recommend that that individual stay home. That is an at-risk patient population, and we don't want to transmit this virus. And we do know that it is contagious, and so we would want to take every step to protect those patients.
Let's keep going right here, please.
Dr. Christ, what is the update on how many test kits are available, and will the governor's declaration of an emergency or executive order change the rate at which we're getting them in?
So the governor's declaration on that won't have any impact on our ability to get test kits from the CDC. We have been working with CDC. From what I understand, and my numbers may be a little bit outdated, we had enough to run 225 samples. We have not reached that capacity, and we are expecting, if we haven't already gotten, another test kit in for another 150.
Could you be considering eventually expanding the criteria for individuals to get tested, in particular more elderly individuals as well as people with mild symptoms?
So there are some limitations that we have because of the emergency use authorization. So we have to operate within that. But we do take on a case-by-case basis and evaluate if that case is high risk. And with the expansion of the diagnostic laboratories, that will increase capacity for those, so anybody with a medical order can go get tested.
We have just time for a couple of more. We'll come back to Mark here.
A money question and a science question. The money question is, where does the $12 million go? And the science question is, have you done modeling or are you doing modeling to try to get a sense of how big this virus outbreak could be? I remember doing that in the state of Washington. I was wondering if you were doing that.
So for your first, I'm sorry, the first question was money. Oh, yes. Okay. So for that funding, where it's going to go, the majority go out to contracts to our local and tribal health departments so that they can do the boots on the ground work, that contact investigation, the case follow-up, and the technical assistance. We will also be using it here for our staff that are providing the technical assistance. We will be using it for laboratory testing and increased equipment, as well as for public service announcements to ensure that the public has the most up-to-date information and knows how to prevent the spread. So that's where that money will go. For the science, yes, we are doing a very similar thing to what Washington is doing. So we have partnered with TGen, and they are getting samples that are, and this is a normal influenza type activity that we do, but any sample that is negative for influenza and viral respiratory infections that is done through certain labs will get forwarded to TGen. They will do the COVID-19 testing and tell us the prevalence of those samples that are positive, and then they are also whole genome sequencing. So that will allow us to identify if there are any mutations, if we're seeing different strains, so that we can monitor what is going on in our community.
We'll wrap it up here. We'll just
Governor,
follow
I don't know if you're the person to ask this, but you mentioned that one of the things you're doing is waiving some licensing requirements. Tell me what that involves. I assume that doesn't mean that Patrick go out and play doctor, but what kind of licensing requirements are you waiving?
So these would be the types of licensing requirements for, say you had a healthcare institution that had a space where they could put additional patients, but may not have beds like that we have licensed. We would be able to go in there and rapidly license them without potentially having some of the normal rules that we would put into place for that.
So this isn't talking about individuals waiving licensing requirements on individuals.
It is. And so it would be it also is individuals. So that's a separate bullet. So when you would look at somebody, say the doctors are just so overwhelmed that we know that they haven't been able to do their CME, you could waive that requirement for them to get their CME for that licensing period. Or if there were barriers in potentially getting licensed, they'd still have to meet all the requirements, but they may not have to get certified copies. And that's on a case-by-case basis by the board.
So just to be clear, we're not saying that somebody who is a registered nurse or even a certified nurse practitioner will be able to do things beyond the scope of his or her license.
Right. They would still act in the scope of the license, and Howie, I'm sorry, I would not be able to make you a doctor under these rules.
Bram, let's go to Bram next. Okay. A couple things, a specific question about the test kits. The number you threw out equals about 100 test kits. That's current rate of abuse. How far, right now you've done 100 tests in the span of about a week and a half. Are you going to have more test kits in a week and a half?
Yes, so we're anticipating a test kit either yesterday or today that will bring another 150 samples that we can test, and we're in ongoing communication with the CDC. And it's hard to determine how many patients that is because there's so many different factors that play a role in how many samples are getting utilized for each patient. If we just get one sample, then it's a 1-to-1. If we get 2 or 3 samples, then it decreases that number. But we're able to potentially batch, which means we use less of the samples for controls. So we're always monitoring that, and the lab is keeping us up to date.
And one more thing, if I can.
Yes.
Governor Ducey, President Trump the other day said to Americans, if you want a test, you can get it. Is that the case in Arizona right now?
If you're symptomatic and you're in a position where you're part of the vulnerable population, that's where you would qualify for the test.
Shouldn't more members of the population be able to get that test? Because the CDC right now appears the tests are being rationed to only the people who are the most sick.
And I'm leaving it to the subject matter expert.
Yes, and so though the ones that we deal with at the Public Health State Laboratory are going to be those high risk, the ones that fall under that risk category. But as we continue to increase capacity with those diagnostic labs, that's when everyone is going to have access. So right now, you might have trouble. We are working with healthcare providers to ensure that they know how to get those samples, where to send them, what to do with them, so that we can increase that.
And are you having any problems with the components used in these tests to get the results you want? We're getting reports of shortages in key components for the tests.
That is not my area of expertise, but from what I understand, we are validated on a different extraction method than the one that is currently having trouble.
Let's go to Bob over
First, you
here.
mentioned licensing extra hospital beds. Are you concerned that the state doesn't have enough treatment facilities, hospital beds, respiratory intervention devices, all those things that are necessary?
So we are constantly working with our hospitals. We get updates on whether they're on divert, whether they're on caution. We monitor if they need supplies. The healthcare system is always something that we are looking at. We know worst case scenario, we might not have enough beds, but that's a worst case scenario. But we always keep it in public health in the back of our mind.
One last question right here.
What are some of those, we talked about the screening visitors to senior communities. What does that screening process look like?
So it can involve a couple of different things based on what that facility has put into place, and this might be a good question for Dave, but it could be a questionnaire asking if you've had fever, if you've had travel within the last 14 days. I've heard that some of them, if you answer a single yes, you are not allowed into the facility. They can do temperature checks when you come in. They can require hand washing when you come in. They can require even more hand washing before you walk into the room and after you leave. So there's a lot of different things that they can put into effect.
Thank you, everybody. As usual, if you have additional questions, we'll be sending out the executive orders and the declaration. You want to reach Chris and thank you.